Welcome to today's video where we're going deep into a subject that could truly save your life. Imagine being able to spot the early warnings of prostate cancer before it advances, giving you a jump on treatment and a shot at a healthier future. In the next few minutes, we will reveal 7 crucial early signs of prostate cancer that you must learn now. Whether you're personally at risk or just care for your loved ones, this knowledge is essential. As we go through these warning signs, keep in mind that information is strength. Early discovery can be the gap between successful treatment and a much harder fight later on. Before we start, if you find worth in health tips and empowering advice, please press that like button and subscribe for more life-saving content. It's not just about clicking, it's about joining a group that puts health prevention and well-being first. We're here to give you reliable information so you can take active steps toward a healthier future. Now, let's go through these signs, beginning from number 7 and moving to the most important warning sign at number 1. Each sign is described in detail, along with advice on what to do if you spot any of these symptoms. So, grab a notepad and stay with us as we walk you through these key early warnings that could change everything in your health journey. At number 7, one of the early warnings you should watch for is getting frequent urinary tract infections or ongoing trouble with urination. You might see that infections come back more often than normal, and these times are joined by issues like a burning feeling, cloudy or bad-smelling urine, or even pain in the lower stomach. Also, you may feel a constant need to urinate but find it hard to do so. This could include pushing during urination or only having a weak stream even when you feel the urge. While these issues might at first seem like small problems, especially if they happen now and then, their repeating pattern could be a quiet clue that something is not right with your prostate health. Paying close attention to these changes and writing down their frequency and seriousness can be very important. If you see that these urinary troubles continue, it is vital to talk with a healthcare provider to find the root cause and take the right steps early on. At number 6, another red flag to look out for is a shift in the power and steadiness of your urine flow. Many people might ignore a short-term weak stream or small breaks as not important, but when this change turns into a regular event, it's a sign that needs more looking into. You might observe that your urine flow becomes less strong, or you may experience a stop and start rhythm while urinating. This change in normal flow can show that there is a blockage or swelling impacting the urinary tract, possibly connected to prostate changes. Over time, these quiet shifts in how your body manages urination can grow into more clear difficulties. Tracking these changes, like how long it takes to empty your bladder or the steadiness of your stream, can offer useful details for your doctor. Dealing with these symptoms early by getting medical advice can help find the cause before more serious problems appear. At number 5, feeling a sudden and lasting rise in the need to urinate is another major sign that should not be dismissed, most of all when it disturbs your sleep. You might find yourself waking up multiple times during the night to use the bathroom, which can not only be a signal of hidden prostate issues, but also greatly impact the quality of your sleep and your overall daily energy. This nighttime urgency is often more obvious because it interrupts a usually peaceful process, sleep, and can leave you feeling drained the next day. Beyond the disruption of your sleep pattern, the frequent urge to urinate can lead to other problems like dehydration or a steady feeling of discomfort all day. It's important to notice if this increased urgency comes with any other symptoms like pain, discomfort, or shifts in the color of your urine. Keeping a diary of these symptoms can help give specific information to your healthcare provider, allowing for an early diagnosis and prompt action that may be key in managing your health. Now for sign 4. Blood in your urine or semen. At number 4, seeing blood in your urine or semen is a serious warning sign that you should never ignore. This symptom can show up as pink, red, or even brownish colors in your urine, or as unexpected spots of blood in your semen during ejaculation. While there can be different reasons for this, from infections to kidney stones, when it happens along with other prostate-related symptoms, it becomes a major red flag. It's important to know that the presence of blood means there could be a hidden problem involving the prostate or nearby tissues. This might be due to swelling, an infection, or in more serious cases, the early stages of prostate cancer. Even if it seems to happen only once in a while, it needs a quick checkup with a healthcare provider who can do the right tests to find the cause. Paying close attention to this sign and writing down how often it happens and if it comes with any pain or discomfort can be very important for early discovery and treatment. Remember, acting early is crucial, and dealing with such symptoms quickly can make all the difference for your long-term health. At number 3, ongoing pain or discomfort in your lower back, hips, or pelvic area can be a worrying signal. This isn't just everyday soreness, it's a constant ache that doesn't go away, sometimes getting worse over time. The pain can change in strength from a dull, steady ache to sharper, more painful feelings that mess up your daily life. For many men, this kind of pain is often blamed on general aging or a hard day of work. However, when the pain becomes long-lasting or is joined by other issues like trouble urinating or changes in your urine flow, it should be taken seriously as a possible early sign of prostate problems. The reason this symptom is so important is that the prostate is located very close to these areas, and any swelling or unusual growth can lead to pain felt elsewhere. Keeping a careful log of your discomfort, when it happens, how long it lasts, and what makes it worse can give your doctor very useful information. By noticing and dealing with these signals early, you can take active steps toward getting the right evaluation and making sure any hidden conditions are treated quickly and effectively. At number 2, erectile dysfunction, or ED, appears as a major sign that can be linked to hidden prostate issues. While ED is a common problem with many possible causes, when it shows up together with other urinary or pelvic symptoms, it may be an early warning that something is wrong with your prostate health. This condition isn't just about sexual performance, it shows underlying changes in blood flow, nerve function, or hormone balance that can be related to prostate swelling or growth. You might find it harder to get or keep an erection, or you might see a lower quality in your erections, which can naturally lead to worry or frustration. It's important to think that changes in sexual function are sometimes the body's way of saying a deeper, whole-body issue needs to be looked at. If you see these changes, especially if they start suddenly or get worse over time, it is very important to have an open and truthful talk with your healthcare provider. Detailed checkups, including physical exams and diagnostic tests, can help figure out if these symptoms are connected to prostate health or if there might be another cause involved. Finally, at number 1, unexplained pain or discomfort in the pelvic area stands out as the most important indicator to watch for. This type of pain is often persistent, meaning it doesn't get better with rest or normal pain relievers, and it can disrupt your everyday life. The discomfort might feel like a dull ache or sharp stabbing feelings, and it could spread to your lower back, hips, or even your upper thighs. Because the prostate is located deep in the pelvic area, any unusual changes in its structure, whether from swelling, growth, or other disease-related changes, can lead to pain felt elsewhere. This symptom is especially concerning because it may be the first clear sign that makes you look deeper, even before other urinary or sexual problems appear. The pain might be mild at first, easily brushed off as a small muscle pull or age-related soreness, but its persistence should not be ignored. Keeping a detailed record of the pain, noting how long it lasts, how strong it is, and anything that makes it better or worse can be very helpful for your healthcare provider in finding the root cause. Early detection through careful watching of these symptoms is most important, as it can lead to timely medical help and greatly improve long-term health results. Thank you for taking the time to watch and learn about these vital early signs of prostate cancer. We hope this information gives you the power to take control of your health and seek professional advice when something doesn't feel right. Remember, early detection is key. It can make a big difference in treatment options and your overall well-being. If you found the insights in this video helpful, please consider showing your support by hitting the like button, subscribing for more health tips, and sharing this video with friends and family who might benefit from this knowledge. Your engagement helps us reach more people with life-saving information. Take a moment now to think about what you've learned, and if you have any questions or personal experiences to share, feel free to leave a comment below. Staying informed and proactive is the best step toward a healthier future. Until next time, stay watchful, take care of yourself, and remember that your health is your greatest treasure.